So I thought what I would do tonight is I would tell you a very personal story and just show the power of Rotary and how that is important to us in this virtual world. And then I'm going to speak a little bit about membership in times of crisis and membership going forward for our organization. And I know Diana Edwards is on the call, so I hope she doesn't slap my hands with some of the revolutionary things that I'm going to be saying today. But anyways, I think Diana knows me by now. So first of all, I'm going to tell you a personal story. And I wanted to start by saying that, you know, as a Rotarian or Rotaractor, we really understand the power of Rotary. But I get this question a lot, and I'm sure everyone on the call does, and that is, what is Rotary? And, you know, when we are asked that question, we're not just being asked, you know, 1.2 million members, service organization, et cetera, because you know that old elevator speech when you're in the elevator, by the time you get there, people are looking at the keyboard and their eyes are glazing over because that's not the information they're looking for. And that's not how we should describe our organization. Instead, we're being asked to define something that is so special and so integral to our lives. Because the way we view Rotary and our experience in this organization is so central to our personal narrative, and that personal engaging story is you know, so much more important when we're asked what is Rotary. So I've actually changed the way I answer that question, and I asked myself, how can I frame my story in a compelling way that explains why this organization is so important to me and how it's changed my life. And I've actually changed my personal story, and so I would like to share with you that personal story. So last August, Mark and my husband Mark and I traveled to Kosovo with the Gift of Life organization that provides life-saving heart surgeries to children. And they usually go to countries that do not have pediatric cardiology programs set up. It is across training, as well as life-saving operations are performed by volunteers during usually a week or a little bit more on these missions. And when we arrived in Pristina in Kosovo, we immediately went to the hospital where we participated in viewing, screening the children for surgery and who would be chosen to have surgery. And I remember standing in the room as the families were arriving and being assessed as to whether they could have the surgery and whether our team that was volunteering that week were capable and whether we had the medical equipment to be able to do the surgeries. One family in particular embodied the value of this mission to me. And they arrived one morning in the screening room with twin boys. And of course, everyone's drawn to twins. They were so cute. They were 18 months old, and one was healthy and one was sick. And unfortunately, the sick twin, his name was Amar. And the parents were in their 30s, and mom was very pregnant and due in the next month. And as I watched, I felt like I was looking at this in her place, through her eyes. Will my child be chosen for surgery? Will Amar be able to run and play with his twin and the new baby? How will we manage if Amar isn't chosen for surgery? Now, as I watched this, again, putting myself as a parent in her place, it didn't matter that I didn't speak Albanian because I didn't need to. Now, thankfully, Amar was chosen for surgery, and the relief was etched on mom and dad's faces, and they were so excited that he was chosen. Of course, the trepidation comes that your child is going to have surgery as well. So it's a very emotional time, as any of us as parents may have gone through this. And then the day of the surgery arrived, and the surgical team asked Mark and I to observe in the operating room for Amar's surgery. Now, as Karen introduced me, I'm a restaurant owner. I have never been in a surgical unit, and I was really nervous, not only maybe of my reaction, but I felt that this was a very private and intimate moment, and frankly, that we would get in the way. But understanding that this was an opportunity that I could not let pass, we said yes. And as we stood in the back of the room, trying to stay out of the way, we were absolutely fascinated by the dance of the operating theater. The teamwork and the constant communication during the open heart surgery process by the whole medical team was absolutely incredible. They obviously worked together before. They were all from California, and they were used to working together because the timing is so crucial to everything that they do. Now, I'm standing in the back of the room, trying to stay out of the way, so glad I made this decision. And all of a sudden, the anesthetist who's standing at the top of the bed says, "Valerie, come and take a look at this from my point of view." And I found myself looking into Amar's tiny chest to see his heart beating as the doctors patched the hole in his heart. And you can see that it is still, a year later, a very emotional story for me to tell. And this was an incredibly profound moment in my life and an opportunity of epic proportions. But what went through my mind at that moment was Amar's mother as I looked at her son through her eyes. Her child would be healthy. Her child would run and play with his brother and the new baby in a short period of time. And incredibly, under the outstanding care of the ICU nurses and Amar's father, who never left his side, Amar was ready to leave the hospital 3 days later. Now, as I said, I felt that this was a very private moment, and I didn't want to intrude. And much of my interaction with the family at this point had been from afar, as I stood in the doorway watching Amar's progress as he was recovering in the ICU. But as Amar and his family were given the news that they could go home, I approached the bed. I wanted to say goodbye, and I needed closure after such a personal experience. So through an interpreter, I expressed to Amar's father how happy I was to see Amar healthy. And now, as parents, they could welcome their new baby into their lives in the next month, knowing that their children would run and play together. And as I said, I get emotional. It was such an emotional moment at that time. And there was hugs and there was tears on both sides. And again, it didn't matter that we didn't speak the same language. We were both parents and our children were healthy. I wanted to share that story with you because that experience changed me. And it changed how I look at things. And it changed what I think we together in Rotary can accomplish. Because this is the power of Rotary. And we must be willing to embrace change to leverage that power. And Holger spoke about change in his address that we just listened to. And we know today that our world is experiencing a rate of change unseen in history. And again, as a business owner, I relate a lot back to business because we know, and many of you are business owners as well, that in business, we constantly need to change. We need to adapt, we need to evolve, or we become obsolete. It's a simple concept. If our products and services are no longer attractive, we no longer remain relevant to our customer base. Because the power of Rotary is the power to elicit change. And the power of Rotary is the catalyst to take us to the next level. And the power of Rotary is the very reason change is expected. Now we know change takes courage because it's so easy to just stay where we are. It feels comfortable and there's a subconscious desire to just stick with the status quo. And you know, I could have just written a check to that surgical center in Kosovo, and it would have been much easier for me to do that than to travel to Pristina and have that experience. But good work would have happened either way, even if I wrote that check. But seeing it with my own eyes shifted the story for me. And it made it clear for the first time in my life, and I've had other Rotary experiences, as was in my bio, but it made it clear for the first time in my life why Rotary's work is so essential. Because we change lives. And we must have the courage to change so that more lives can be saved and that the impact of our service continues to grow. We need to be willing to look differently at how we're doing Rotary and what we're doing in Rotary. And we need to be willing to look at the Rotary experience through the eyes of our current and our future members to ensure that we're delivering what it is that they value. We need to change the narrative, we need to change our language, and we need to change how we speak of our own experience in Rotary. Because what we do every day as Rotarians is not normal. It's incredibly transformational. each and every day, with every life we save, with every mind we educate, with every attempt at peace, we are transforming lives. One of my favorite Paul Harris quotes, when Paul Harris famously once said, "It's a changing world and we must be prepared to change with it." Well, right now, at this moment, we are seeing change in our organization and the world. We're living a time in history, this pandemic, it has changed us as individuals, as a society, in business, and in Rotary. We have shifted, we have been innovative, and we have been resilient. Now, one of the things I didn't realize before our board meeting in June, which was virtual, was that we have a PhD statistician on staff at Rotary International. And he took the time to analyze our membership data, membership numbers during worldwide events like the Great Depression, World War II, the energy crisis in the 70s, and the 2008 recession. And the findings were incredible. And that was that during times of crisis, our membership numbers do not see a dramatic decrease. In times like this, in times we're living like today, the world needs Rotary more than ever. And we need Rotary more than ever. You know, President Holger's theme, Rotary opens opportunities, could not be more relevant or prophetic. We have an opportunity before us to look at our clubs through a new lens. Perhaps we pivot to a hybrid model of meeting online for one meeting in a month, for a social meal another time in the month, and a hands-on project in our community. I quite often say that nobody should be excluded from Rotary because of the cost of the meal. And some of the complaints that we hear the most about people who join Rotary is the cost and the time commitment. And we have an opportunity now to shift that. Perhaps we start a cause-based club with key focus, and I'm seeing this all the time in our districts. As I say, I'm seeing the innovation. How about a cause-based club that focuses on water, that focuses on the environment? We just approved the 7th area of focus as the environment. Every district should have a cause-based club around the environment and what that means to their community, the greater world, and our country. Or the homeless in our community. I was speaking to a district governor in March at a president-elect training seminar on the West Coast. And not only did clubs in their community realize that homelessness was a situation that they needed to address, but the district decided to take on this initiative collectively. So just think for a moment about the multifaceted approach to dealing with the homeless in your community and working with the partners who are already active. You know, it could be around food sourcing and you're working with the food banks, or it's a homeless situation for shelter or clothing. So there's so many ways to work with the partners in our community. And not only that, but you'll get known in your community for what you do best. And that is when there's a community need, we get out in the community, we roll up our sleeves, and we make sure we get it done. So cause-based clubs, I believe, are a really great way of attracting new members and moving the way we do Rotary. Now, I just mentioned that we don't see a decrease in membership in times of crisis, but it would be very remiss of me not to take some time to talk about the decrease in membership in North America. And I want to use the word crisis, and I don't take that lightly. Internationally, we have seen a decrease in membership for the last 14 years. We all know that we're 1.2 million members. That's because that number hasn't changed. And so it's a really easy number to remember, unfortunately. But in North America, in the last 5 years, the results are alarming. In fact, it's why we rezoned as of July 1st. And we lost a seat at the board of directors table because of that. And while membership is declining in North America, it is growing in other parts. And of course, that's where the Rotary International Board seat went to. But last year, 80% of the decline internationally was attributed directly to North America and the Caribbean. A decrease of 12,000 members just between the US and Canada. And it's really too early to say whether this was COVID related. So we've been talking about North American membership for many, many years. And Diana's on the phone, and so much great work has been done by our district and zone leadership teams, by our partners at Rotary International, our club and district support, our regional membership officers. But we need to look at this now in a very revolutionary way. We need to be visionaries, and we need to get the message out to club Rotarians that when we talk about Rotary, we should be speaking about the Rotary experience, not just our Rotary clubs. I want to use another business example. We've all left positions in our companies, and it's not necessarily that we don't believe in the corporation or the company that we work for or the products that we're selling. It's almost always, and I'll speak about personal experience, it's usually about our direct supervisor, our boss, or our coworkers. It comes down to the culture of the organization that we work for. Now let's think about that in our Rotary Club context. Personalities come into play. We hear it all the time. In fact, I would challenge the fact that we're seeing more people come in our online presence that we haven't seen in a long time. Maybe it's convenience, but maybe it's the fact that we're taking out some of that conflict and personality challenges that we see at our club level. So when we're not happy in our corporate job, we know the grass is greener on the other side. We put out our resume, we shop ourselves around, and we find a place where the culture fits. But I'm going to suggest that the Rotarian at our club level who has not been exposed to Rotary beyond their club, maybe not at the district, maybe they haven't gone to a district conference, maybe they haven't gone to an international convention, they don't understand that the Rotary experience is so much more than the Rotary Club that they belong to. So my challenge, I think, to everyone, and I'm certainly putting this challenge out to my Rotary coordinators and our zone leaders, is to get that message down to the club Rotarians and let them know that there are alternative club meeting models. And again, the silver lining in COVID has really allowed us to explore more of these models, whether it's satellite clubs, whether it's passport clubs, or whether it's cause-based clubs. But I don't believe this message is getting to our club Rotarians. The opportunities are endless, honestly. We were on a call the other day with John Hugo, and I can tell you that he's using words like, we need an army to address this problem. We need to be revolutionary in our thinking. And I know that he has given us the commitment, and the Rotary International staff have given us the commitment that you're only limited by your memory. If you think of how you want your Rotary Club experience to look, then the conversation is open. And I will say that if you have run into any roadblocks at all, I will be your biggest advocate to help you realize your concept. We're looking at things and addressing some of the legislation around and our policies and procedures, and looking at bringing forward items to the Council on Legislation in December that address things like you have to have so many members to charter a club, or my favorite, actually, which really isn't relevant, is that actually in our bylaws that you have to live or work in the geography of the club you belong to. So these are outdated concepts that we've already moved on past. So we need to make sure that our policies are up to date. And I can tell you that everything is being looked at, from club name to jurisdiction to the way we meet and the number of members in our club. So I really want to encourage you to think outside the box. You're only limited, as I said, by your imagination. But I want to thank you for all that you're doing. I want to thank you for holding this special membership summit. I want to thank you for adapting, and I want to thank you for being innovative. And I know that when we're able to meet again in person, that our organization is going to be stronger and more relevant in the world that we're living in, whatever that may look like post-COVID. But I'm excited. I'm excited about where our organization is going. I'm excited about different forms of membership. And I just want to emphasize to you that it's the Rotary experience. And if we think about the Rotary experience, whether that's international or it's in our club, I believe we will engage more members, and we will perhaps close that back door of the members that are leaving our organization. So I want to thank you for inviting me today. I welcome any questions. I haven't been looking at the chat box, but I'll throw this back to Roma, and I want to thank you so much for inviting me to be with you tonight.